Hello and welcome to Sick Notes. My name's Dr. Ed Hope and we're joined again, Dr. Lizzie.
Thank you for having me.
Our super expert GP. You taught me so much about symptoms last time. I'm supposed to be teaching people at home, yeah. It's actually a bit of a disguise for me to learn. We talked about the most common symptoms of lots of different things last time. So if you're interested in common symptoms of things like cancers, MS, diabetes.
Diabetes is a big one.
Dementia, you can check out that video. I'll leave a link up there. You see, I'm getting pro now.
I'm very good at this.
But today, how do I know if I have...
Insert here. ...
10 questions on Google. Some of these might not be medical.
Well, we'll just give life advice if not.
We'll solve the problems, because obviously as doctors, we've got our lives sorted.
Totally.
Let's get on with it. So number one.
Okay. Split it off. How do I know if I have diabetes? We talked a little bit about this in the symptoms one, but diabetes is a really important sort of disease to be aware of. So I'm really pleased actually that that's top of our list. So people are interested in it, and hopefully if we can tell you some of the symptoms and how do you know if you've got it, we might move it lower down the list because everyone will know everything that they need to know.
What's going to happen? If
you are perhaps drinking more, so drinking lots of fluids and peeing out a lot, that is a big cause of symptoms of diabetes, as well as generally feeling rubbish and tired. So those are the things to look out for.
So if I came to you with these symptoms, how would you tell me that how would you find out that I had diabetes?
So the first thing that we do is have a chat with you and talk a little bit about those symptoms specifically that I've just mentioned, and perhaps ask a little bit about some of your medications, because the other thing is things like steroids can increase your risk of diabetes. People often forget that. And then I would examine you. So we'd do height, weight and blood pressure for the sort of type 2 diabetes, which is the common one in Western society that you develop when you're older due to sort of lifestyle problems. And then I would get you to pee in a pot for me, Ed.
Wow! Anytime.
And I'd dip it and see if you've got any sugar in your urine.
Fine, gotcha. And then I guess formal diagnosis, we tend to do a blood test, don't we?
Yeah.
How do I know if I have worms?
Have you ever had worms, Ed?
I haven't had worms. I guess, what are these?
You probably did when you were little.
Oh,
actually.
really?
Yeah.
What are the worms we're talking about?
So there's lots of different worms.
Okay. I probably have had. Cheeky thing.
So we're not talking about your garden worms.
Are we talking about thread worms?
Yeah.
Okay.
So you get worms that sort of live in your gut are really, really common. And I say you've probably had it because it's really common in children. Okay. So thread worms, they lay their eggs around your butthole.
Okay.
Which is great, isn't
it?
Yeah.
So why not?
I know. And children aren't very good with sort of hygiene, so putting hands in their mouth and not washing hands, playing outside and things like that. And what can often happen is when the eggs sort of start to hatch, you get itching around your bum. And mainly at night actually. So that's one sign of a threadworm.
Okay, fine. And how do we treat them?
Well, the weird thing is to diagnose them, you have to do a thing called a sellotape test. And just have a think about that for a moment.
Okay, other brands of sticky tape are available.
So we might ask you to, at night time, get a little bit of sellotape around your anus and pop it on, pull it off and put it in a little plastic bag. Believe it or not, we then send it off to the lab. And they look for worms.
Very good.
Nice easy treatment though. A tablet for you and the rest of the family.
And sorted.
That's it. Oh God, what am I going to get? How do I know if I have anxiety? Everyone has anxiety, first of all. And again, we spoke a little bit about this in our last talk.
I've got anxiety about worms now.
Yeah, sorry about that.
Okay.
I'm sure you're fine, don't worry. The common things are feeling anxious, and everyone says that, so just take a second to think what that means to you. Most people describe butterflies in your tummy, sweaty palms, your heart racing, lump in your throat. Those sort of things sort of come with a panic attack. And people get the panic attacks, but also they can just have that feeling of dread sort of continuously. And the difference between having anxiety, perhaps before going on to perform at all, you know, if you're a musician, an actress, you get anxiety before an exam, we all get anxiety, to having an anxiety disorder, which is where it affects your life and is actually quite a big problem. They're the two types of anxiety.
Gotcha. So I guess that's kind of common to a lot of mental health things, isn't it?
Absolutely.
So basically mental health, you know, a lot of the feelings that are associated with it are quite normal feelings, but they become, you know, they start taking over your life, they start, you know, limiting what you do, and that's when it becomes a problem, and that's when you need to come speak to a doctor. How do I know if I have flu? So when we talk about flu-like symptoms, we talk about the classic, don't we? So sore throat, cough, you know, feeling feverish, kind of muscle aches.
Muscle aches is a really big one.
So when is just we have a sort of common cold, and when do we have the flu? What's the kind of...
The sort of question I ask my patients, I'm giving away all my little tips here to you guys.
me?
Is if you saw a £10 note on the floor, would you have the energy to get up off your bed and go and get it?
Definitely.
You don't have flu.
Oh, okay, fine, got it. Okay, so it's really where it's the severity is the best marker, right?
Yeah, so flu is quite a sort of hot topic, normally around the winter time. So the influenza is a virus, the same way as the common cold. But if you get a true influenza virus, rather than just a general virus like rhinovirus, the one that causes colds, then it really does lay you up in bed and makes you feel absolutely rotten. Some people do end up having to go into hospital if they have very bad flu. But generally, it's just a case of sort of making sure that you're taking enough fluids, resting up and things like that. And the other thing with flu is there is a vaccine that you can take if you tick certain boxes, if you're older, you've got things like asthma that can help get flu. Let's see what I'm going to have. How do I know if I have a CCJ?
What is a CCJ?
I have no idea what a CCJ is.
I think it's a counter-court judgment.
Oh, I hope I don't have one of them.
But I guess this leads into the question is what people coming to see doctors about irrelevant stuff. The worst I've had in A&E was a lady who brought her child in because the child's hair wasn't growing quick enough.
Now, I didn't have this, but one of my colleagues did. I had someone come into A&E because they had holes in their face when they smiled. Dimples. Just, there we go.
Diagnosed dimples.
How do I know if I have bed bugs? So you got worms, I got bed bugs. We're not going to have many friends after this, are we? The only real thing to sort of worry about with sort of bed bugs and things is if you are perhaps allergic or have a sensitivity to it. So people with asthma sometimes find that bed bugs are one of the triggers, the causes for their sort of symptoms to flare up. I've never treated anyone for bed bugs.
So basically these are bugs that live in your bed, obviously, and then at night they feed off you?
Yeah,
or like your blood
they
or
eat all the
skin and stuff, fine. So bed bugs live in your bed.
Yeah, well done.
Thank you. Scabies lives on you.
Yeah.
That's kind of difference, right?
It is different.
So I've actually had scabies, should I be saying this? I'll cut this out if not. I got it from a really dodgy hotel that I stayed in Eastern Europe, and that was horrible. I mean, just, the itchiness between my fingers and toes and just everywhere really. And had to go to, this is before I went to med school, I had to go to the GP a couple of times to get it sorted out. And basically the treatment is you have to treat everyone around you, cream, I think 2 or 3 times over a week, and basically put all your clothes on a nice hot bonfire.
I think it's important that you say it because actually it's really, really common. We often see it perhaps in what we call sort of institutions, so hospitals, nursing homes and things like that, because it's quite easily spread with sort of washing and things like that.
I noticed you just shifted over slightly.
Yeah, I'm just going to go out of the camera.
How do I know if I have piles?
Ed's not doing well today, is he?
Super common.
So common. There isn't a GP surgery that I go through without diagnosing or talking about piles or poo.
So what are piles?
So the medical term for piles is a hemorrhoid, They're really, really common. They are basically blood vessels around what's called your anal cushion.
God is cruel, isn't he?
He is very
cruel. Why would you put blood vessels down there?
Well, yeah, he wasn't thinking, was he, perhaps?
So basically they're caused by constipation and straining, or I guess just because
pregnancy,
they happen.
Increased pressure in the sort of abdominal cavity.
Gotcha. And so that forces the blood vessels down.
Yep.
So the main symptoms...
So you sometimes can get a little bit of bleeding when you open your bowels, and it's really important this. With piles, the bleeding can be sort of on wiping, so you often notice it on the tissue and it's bright red, or sometimes it might even just coat the outside of the stool. Can be a little bit painful or a little bit of itching. If you ever get blood mixed in with your poo, or you've got a change in your bowel habit, so you're more loose or you're more constipated, that's unlikely to be a pile, and that's when you need to come and see me.
Sounds good. And piles normally just treated with cream?
Yeah, cream, suppository. Sometimes a pile can sort of come out of the bum, so you get inside piles and outside piles. If they're staying outside the bum and they're causing you a lot of problems, then on very rare occasions the surgeons might intervene. On that note, we'll move on.
Yeah, so the main symptoms really are just the bleeding and the kind of lump that you feel when you're wiping your bottom. Come on, let's see
what am I going to get? Hey, how do I know if I have Amazon Prime? Mainly because money comes out of my account every month, I think.
Next, how do I know if I have depression?
Oh, this is a really important one, I think.
So we talked a little bit about anxiety before.
Yeah.
Depression
often comes together, and we often see them together. So depression is low mood. But depression from a medical sense is, again with the sort of anxiety, it's the low mood that persists, doesn't improve, and we can't really put it down to just a fleeting change in life circumstances. So you get low mood, loss of interest in things that you used to do. For example, if you used to dance, you don't want to go out and dance anymore. Your appetite can be affected, your sleep can be affected, and then the more sort of serious sort of thoughts are you might think of hurting yourself or committing suicide, and feeling really guilty about having those thoughts as well.
So it's interesting, of this list, people resorting to the internet to find out stuff about anxiety or depression. So if you are worried, if you just have concerns about this stuff, there's people there, aren't there?
Absolutely. Again, as a GP, a very big sort of proportion of my work is with mental health, so depression is very common, and people don't often come to me first. They either don't come to anyone, talk to their friends and family. There is a big drive at the moment for mental health, so you've got the Royals doing their campaign, it's on TV adverts, every railway station has got the Samaritans number there, so we're still not very good at talking about it though. So the biggest thing I can say is, if you are worried about depression, use online resources, speak to someone, and if you don't know who to speak to, come and see me as your GP, and I'll make sure you get sorted and plug you into all those services.
Last one.
Here we go. How do I know if I have IBS? IBS stands for irritable bowel syndrome, and it's really common.
There's kind of two types. So there's the kind of where you get constipation and when you get diarrhea. It's associated with sort of crampy abdominal pain, change in bowel habit, but there's no kind of underlying problem. So it's kind of a diagnosis of exclusion normally, isn't it?
Yeah.
So they try and figure out, make sure there's nothing else going wrong with the bowel.
What we have to do is make sure that it's not inflammatory bowel disease, things like Crohn's and colitis, and things like celiac disease. So IBS is an irritable bowel, so you get some crampy pain, you can get sort of loose stool, constipated, sometimes you can get sort of a pain when you're having sex, sometimes pain on passing urine as well, so it's a big sort of constellation of symptoms.
Super common as well.
Yeah.
You see so many people, and difficult to manage.
We don't really understand much about it. There's a lot of theories. Is it sort of immunological? Is it related to diet? IBS Society is a great place to start. You can sort of change your diet. So there's a thing called a FODMAP. You can pop that into Google, to do with sugars that perhaps cause IBS, and a food diary can sometimes be really, really helpful so that you can sort of manage those triggers.
So probably something that we'll find out a lot more about as
Yeah.
things go. It's kind of one of those things where I think a lot of people feel like they don't get a satisfactory response from a medical team, because we sort of can often be quite dismissive of it, because we can't exactly say this is the diagnosis and this is the treatment. So I do see people that get frustrated with the management, and they kind of feel like the doctor, we make patients feel like they're kind of making it up. And
I think that comes back to us as doctors and the responsibility we have in the way that we talk to you and explain things to you. And because whilst we might not have a satisfactory medical explanation, that doesn't mean your symptoms aren't real, okay? And the difficulty as well is a lot of the treatments that are effective are things like antidepressants, cognitive behavioural therapy, and people jump to a conclusion if you don't explain it well.
You've got to have respect for the gut though, innit?
It's an incredible organ and a very overlooked organ.
Exactly. It's got its own brain. Anything with its own brain demands respect. Okay, we've done them all.
That's pretty impressive, Liz.
So we've gone through how do I know if I have all these things. Thank you very much for joining us. Thank you very much, Dr. Lizzie.
Thank you for having me back.
And if you like this, please check out our previous video where we looked at the top 10 most Googled symptoms. If you enjoyed this, then there's some other videos as well. Thank you again for watching, and we'll be back soon.
Bye.
Bye.